Hi guys, thank you so much for joining me today. My name is Adriana, the SPTA, and today, like you read in the title, we will be talking about skin assessments, specifically the blanching test. So why is it important to do skin assessments? It's important because the skin is our biggest organ and the most exposed. So when we wear braces or sitting in wheelchairs or even laying in bed, where our skin is prone to those sores or even redness or irritation, so it's important that we're constantly checking the skin. If it's not only for our patients but for ourselves as well. It's super important to always check that. So, like I said, we're going to be talking about the blanching test. So, what is the blanching test and what is it? What is the purpose? So, the purpose of the blanching test is to make sure that we're checking for circulation. And it gets down to those little itty bitty crevices in our fingers. And then also just the general look of the skin, making sure that everything's looking normal, that blood flow is going, and yeah. So, how are we testing for this blanching test? What are we doing? So, with the blanching test, it is kind of crucial. Like, yes, we can check in different areas, we can check all over the place, but it's super crucial that we're checking the area that looks irritated or that is red, even if that means that we're pressing down on the sore areas. Those are the most susceptible to wounds or skin irritations, so it's better that we're checking the circulation in that area than somewhere in the ankle when the redness is in the elbow. So, how do we perform this test? When we're performing this test, we're going to make sure that we're testing in the irritated area, the red area. So we're going to slowly or lightly press down with about 4 to 5 seconds. Hold it down for 4 to 5 seconds. We're going to release. We're going to look at the skin. We're going to make sure that the capillary refill or the blood flow is coming back to the area that you pressed down on within 3 seconds. That's pretty normal for everybody, so we want to make sure that it's coming back within 3 seconds. If it doesn't come back, it's kind of a sign of arterial insufficiency, and that's something that we don't want. We'll probably go into that a little bit more specifically later, but right now it is it's pretty bad. We don't want that right now. So, to kind of break down the blanching test a little bit more, as you see behind me, there's a little flow chart that I kind of created. So, with this flow chart, I broke it down into 2 little areas. The area blanches and then the area doesn't blanch. So to start on the first side, the area blanches. Let's say it returns within 3 seconds. That's pretty normal, right? But we still want to make sure that we're investigating the area because it is red. We want to know why it's red. We want to know if the brace fits right or the wheelchair is fitted right. We kind of want to see why the area is red regardless of it returning within normal limits, right? So moving on, let's say it blanches again, but it doesn't return within 3 seconds. So let's say it doesn't return in 3 seconds. We want to make sure that we're taking a distal pulse so that it's either getting to the fingers and that the circulation is still getting down there. Let's say it doesn't, or let's say the pulse is weaker. So the decreasing pulse is kind of a sign of arterial insufficiency. Like I said, that's something that we don't want to occur. So what do we do next? Regardless of what area you're in, we always want to consult the PT because that's very abnormal. We don't ever want to experience anything like that. Or we want to be aware and kind of be proactive and not reactive. So regardless of what happens, we want to make sure that we're consulting the PT. Alrighty, so moving on. So it doesn't blanch. So what are we doing? We don't want to freak out, so we want to make sure that we're waiting 15 minutes after the first blanching test, just because the area might have been in the brace for so long. It just needs to air out. It's kind of releasing, and then so we're gonna wait about 15 minutes. After that 15 minutes is up and it's still not blanching, that's a sign of the development of a wound. So now it's a wound care scenario, something that we wanted to avoid. But this is very fast acting. Consult the PT, consult your doctor. We want to make sure that we get this taken care of right away. So that's kind of like a breakdown of what the blanching test is and kind of the signs and next steps to take when it comes to the blanching test, and kind of things to be aware of, things when to consult the PT and when to not. But yeah, so that's kind of basic breakdown. Thank you so much for joining me today. I hope you learned a little bit more about skin assessments and having the ability to allow yourself to assess your own skin. Have a great day.